Today we are discussing tuberculosis, otherwise known as TB. TB is a very dangerous disease, which of course, according to 2020 statistics, it has affected 10 million people, of which 1.4, 1.5 million death has been recorded. This is what we're going to discuss today. Very contagious disease that we need to take a second look at. Kindly follow us on Cafdil Cape Coast on Facebook and Cafdil Edu on YouTube. Follow us, share, and like the comment, or leave your comments there, and certainly we will read them for you. I've been joined in the studio here by two distinguished health professionals from Cape Coast Teaching Hospital, in the person of Evans Agamlo. Evans is a public health officer at Cape Coast Teaching Hospital. Evans, you are welcome.
Thank you.
And also Abu Kwabna. Abu Kwabna is also a disease control officer from Cape Coast Teaching Hospital, and a very good friend of mine, of course. Abu, you are welcome.
Thank you.
Yeah. Like I said, tuberculosis is very, very dangerous and contagious.
Yes.
You are the disease control officer, so I want you to give us the overview of TB so we can know exactly what we're talking about.
TB is one of the infectious diseases that we have in the world. Yeah. And maybe the only difference is that TB is a bacterial disease, meaning that it is bacteria that causes the disease. And the name of that bacteria is Mycobacterium tuberculosis. Yes, so the disease can affect the lungs and also can affect other parts of the body. But it is mainly the lungs that suffer the disease the most. And it is so because we breathe in air. And as it stands now, air is the most common mode of transmission of the TB disease. Okay, so it means that when you take in air that contains the TB bacilli or the Mycobacterium tuberculosis, surely the first cortex or the organ the air will land is the lungs. And that if there are the disease-causing organisms in that air, then they will be invading in the lungs in the first place. That is why we have the pulmonary TB. That is the TB disease that affects the lung, being the highest or the most common one. In some few cases, the disease-causing organism, which is the bacilli, may end up being trapped along the tract into the lungs. Okay, so it means that in this case, the disease-causing organism will invade any other place outside the lungs. Sometimes, some also get to the lungs and try to find their way any other parts. So it means that in this case, they are not invading the lungs, but they are invading any other part of the body. Okay. In any case, they are all caused by a single disease-causing organism known as Mycobacterium tuberculosis. And as you introduce it, World Health Organization has reported that 2020 we had close to 10 million people across the globe being affected by this particular disease. And then we have close to 1.5 million people getting died or being died from this particular TB disease. Yes, this is data that has been reported to the health facility, and the health facility has also been able to, report it through the various channels to international level. Those who couldn't even report, or those who we couldn't have their data, they are not part. So it tells you that the TB disease is very detrimental, but its prevention and treatment are all free and they are, available. As said, airborne is the most common type of the TB transmission. Meanwhile, there are also other forms of the transmission or medium for transmitting the disease. we can also have animal to human type of transmission. But because our focus now is on the human being, I think I wouldn't want to highlight much on that one.
It would be imperative to highlight because we stay with our pets,
Okay.
dogs, cats, and stuff. And some of them, if they are affected, certainly once we are close or closer to them,
Okay.
the brain. So
I
when you
understand.
infuse that one, it will also help us more.
Okay, that's fine. So before I entered the studio, the only animal that we are too much aware that they also harbor the TB bacilli, and the TB bacilli is able to grow in them is cow, and their type we call it bovis, bovis type of TB. And in killing the cow in their preparation and eating it during their stages, you can be exposed to some of this type of the bovis disease, and that is also a form of, the TB we are talking about. And apart from that, we also have contact, person-to-person contact. As we sit here, if I have TB disease in me, automatically I have the bacilli in me. The moment the signs and symptoms will start showing, which of them is the cough? If I cough out and I didn't control or I didn't practice good cough etiquette, it means that I have released the organisms into the atmosphere. And dependent on the proximity, you can easily inhale them directly, or they will be suspending in the air for some time. So within that small space of time where they are still hanging on the air, anybody that comes around has the chance to breathe the air that is available here. And because the air is infected with that particular disease causing organism, you stand a greater chance of, being infected by the disease. There's another one too. When you cough and you throw out the sputum, that's how we call it, or the saliva or whatsoever, into the environment, it is not advisable. And we are saying so because as the air blows, the sun shines, that content you've thrown outside they will dry. And when they dry, it is believed that the disease causing organisms are in that particular uh, thing that has dried. Air will carry them along. And anybody who moves around that part and breathes in the air has also got an opportunity to get there as being infected by TB bacilli. All right, so I think on that note, I would want to say this is enough for the overview. Okay, unless maybe there is a question you want to.
No, I want Evans to also tell us. Maybe you may also have some kind of.
I would like to add just a little bit to what my brother said. You see, according to WHO, if you come to tuberculosis, for instance, like among all the infectious disease, it rank up at the second most leading cause of death. So, as at 2021,
among children or adults?
No, among
everybody. Okay.
So you see, as at 2021, the whole world is fighting COVID. So COVID, at first, it was tuberculosis that was taking number one position. COVID came to take the number one position. So if you are talking about TB is very, very risky, very, very dangerous. But the other thing that my colleague also made mention is that like tuberculosis treatment for now in Ghana is free. And I want to also put it across that it's curable and it's preventable. It's curable, nature said, like if you contract the condition or the disease, it's not like HIV that will be like, okay, be on drug till you die, or be on drug till God calls you home. This one, there are drugs available that they put you on it, and at a particular point in time or like a defined time frame, you'll be cured totally and come back to normal. So people should not be scared that much. Or if you contract the disease, come to the hospital, and then we help you to get you the drug, the test, and everything, and cure you of it.
It means that initially, and I could TB, being a TB cry, or anyan that kind of thing, fano, that kind of thing. It means we were not having what the cure. I mean,
exactly.
So now that we have the cure, people should not be afraid. Just visit the hospital when when you are affected
You
or
know, at some point in time when COVID came, they said we don't have a cure as at the moment. Meaning at that particular moment we don't have cure for COVID. But right now there are drugs that they are using to treat COVID. So as at that particular point in time, we don't have cure for TB, but we've now had a cure. We are having a cure now. So if anybody is infected with TB, the person is not to, let me say, put in some room in some village and say, okay, this person here is bound to die. No, the person is bound to live. Only if we bring the person to the hospital and then we administer drugs.
All right. And so, just as my brother is saying, there's a term, but I don't know how to put it into fancy. They call it a foo. I don't know. That you see people with TB has been one of the reasons why some people today are carrying it. They didn't know.
So, repeat.
That a foo. Most of them are as a result of TB. The hunchback you see people carry. I said it somewhere that you see this TB affects any other part apart from the lungs. They can affect your vertebral column. Okay, and it will cause you to bend as if something is in there because there wasn't treatment. People were not having any form of diagnosis to find that this is the problem. This is the actual problem. They will attribute it to any mythology or any particular thing that doesn't even exist at all because they don't have the knowledge. Most of our relatives, most of our good ones have died off innocently because they didn't know what is TB. Yes, and some of them are carrying complications because of TB. And just as I've mentioned that most of them who are carrying it today are as a result of, most of them are as a result of the TB disease. TB disease can cause anything. It can even affect your eyelid. Yes. And look at how dangerous the whole thing is. So it is important that viewers should pay much attention and attach great importance to the fact that yes, there's cure, there's treatment, investigations about it. Until you get cured, everything is available, is accessible, it is free.
Me crash me because yerba say ibi obowo na so wobi na kutwom ho a ibrita wonsabaka. It's more dangerous than STI, sexually transmitted diseases, because that one, if you have not had any kind of
that one there is a disease of an option. If you want to get it, you get it. But for TB, you can get it anyhow.
It's dangerous
anyhow. So yeah, that's how it is. That's how it is.
You watching Cafdil television. We are discussing TB, tuberculosis, and we've now seen how dangerous and serious this disease is. And so we have to be keen, especially when you are in a midst of a dom, bimo bowo na do one kata one hen. Our ankasana ewo among them no. Try that was to be protecting is a free democrophone. It be oba a refuse. General na wall na ba na hunting we sneeze na aba refuse. Nti obandama, what do? You have to protect yourself. If you also forget to protect yourself and the person is carrying that bacteria, certainly you also contract it. Yes. Don't forget to follow us on Facebook and on YouTube. Facebook Cafdil Cape Coast and YouTube Cafdil Edu. And follow us, share, so your people can also get the opportunity to watch this important topic. But do we have a group of people who are at a high risk of contracting this disease?
Okay, thank you very much. When you come to risk of contracting the disease, we have two different aspects of it. We have something we call predisposing factors. So predisposing factors are, let me say, things that one way or the other is subject you easily for you to get the condition or the disease, the tuberculosis disease. And some of these things, we have one aspect as comorbidities. Comorbidities necessarily like other conditions that can bring your immunity down that anytime you come into contact with the tuberculosis, the bacteria, you can easily contract it and it can easily manifest. So we have most of those comorbidities such as HIV/AIDS. Like people who are suffering from HIV/AIDS, it predispose them or it expose them easily for them to get the TB. You have people also who are suffering from diabetes. You see, diabetes now is rampant everywhere. Most of the elderly, even including young ones, are getting diabetes left and right. So people who are also suffering from diabetes can easily contract TB because of the diabetes has suppressed their immune system. Um, we also have people such as those who are, let me say, they are chronically malnourished. Is it chronically malnourished? Meaning it's not that this person has, let me say, lack food for 1 month, but the person over the years is malnourished. Kwashoko. People say kwashoko. Even adults, you can be malnourished at some point in time. If you are not taking in the right diet, the right nutrients, you can be malnourished. So such people are easily predisposed to the TB condition or TB disease. We have people also, let me say, economic factors. Let me say, like, because of poverty in tea, where they are living, their lifestyle, and all those kind of things. If where they are living, if let's say somebody is exposed or somebody is having the disease, the probability that they are going to have it is higher than normal people. Uh-huh. Then when it comes to the risk factors and the risk factors, things that one way or the other increases your chances of getting it. We have something like occupational, let me say, hazards. Occupational hazard, interested people who, let me say, they find themselves in an environment where it's likely to find TB positive people. So when it comes to the hospital facility, we the health professional, the doctors, the nurses, it's easily for you to get TB.
Including the patient, the visitor.
Exactly, those who come to
The hospital, the facility, yeah.
the facility. So we call something like a nosocomial infection, meaning you come with, let me say, you come to the hospital with malaria, but because of hospital setting, there are other conditions that you may live with skin infection. So that skin infection become we classify as a nosocomial infection. So if let's say for instance you come to hospital and then your system is that, let me say, your immune system is that low and there is an infected TB patient who is coughing anyhow uncontrollably, like my brother made mention of. You see, if let's say for the person is coughing, no nose mask, the person is not coughing into any handkerchief, the person is not using the elbow or this thing to prevent the coughing from going out, the condition itself is airborne, so the bacteria can suspend in air for some hours. So if you also inhale it directly, automatically you are going to get that infection that you've not as in like subscribed to. So most nurses, most doctors, they are all at high risk of getting TB infection. The same way we have people who one or the other they smoke and they drink alcohol. They too, their immune system is very, very low. So most of the time they come into those kind of things. Then we have people, let me say for instance, if a house that we are, maybe we are I rented in the compound house and somebody is having the infection in that house, the person maybe unknowingly is not treating it. The person is coughing anyhow. I also live in the same house. I share the same hall with the person. The probability that that air is, let me say, like infected and I can also come into contact with the bacteria is very, very high. So people living in that house or that environment are at high risk towards TB. Yeah. So those are some of the things.
Abu, I want to take you back
Okay.
and to the symptoms of that TB because in your overview I did not hear much about the symptoms.
Okay.
So that is very, very important. So I want you to highlight the symptoms of this TB for us.
Okay, that's fine. TB, as it stands now, let me bring the two types, the two broad types we have.
We'll come to the types.
Yeah, so if you want to know the symptoms, it means that one might come with symptoms.
Okay.
And then the other might not come with any symptoms. So if I want.
Then, so what I want you to do, so tell us the types.
Okay, that will
Then
come with the symptoms.
Symptoms.
Oh, okay. So
And
the types,
how does each type affect the body as well?
okay. So we have the latent type or the inactive type of the TB.
Okay.
Now, what this one means is that the TB bacilli is in the body, okay, but they have not developed to a stage where they can compromise the immune system and you begin to get the disease. You see, the signs and symptoms begin to show when it has gotten to the disease stage.
Okay.
But with the latent type, you've gotten the infection, but there is no disease causation. That is one part of the body. So, one part of the TB disease. So this time you will not get. If you want to know whether you are diseased, there is a type of investigation you do to see if the bacilli has actually invaded your body or not. But the active part or the active type of the TB disease, with that one, whether you like it or not, this type, they are active because it has gotten to the disease stage. And in this stage, you will show signs and symptoms. And one of the major and the common type of the TB disease symptom is the cough. Yes, especially if the pipe is affecting the lung. Then you can't take away the cough if the type of TB disease is affecting the lung. Then another symptom that you should be looking out for is night sweat. You'll be sleeping and you'll be sweating profusely as if you are weeding in your farm.
Within in your dreams.
So all those things are typical signs of the TB disease. You will be feeding, you'll be eating well, but you will not be increasing in weight. You see that you'll be losing weight.
Loss of weight.
Loss of weight. Very good. And because sometimes there are cough involvement, you see that your chest is paining you. Sometimes you get some form of stretching and your chest will not be comfortable at all. Yeah, so when we are looking out for signs and symptoms for TB, we should actually target these things. But one thing I would want listeners to also understand is that we don't need to sit down for all these signs and symptoms to come together before we say, okay, one doctor came to speak about TB. He said we should have these 4 signs of symptoms before we report to the health facility. Anything that doesn't go well with your system, the only approach we are advising listeners is that, well, you can go for the over-the-counter drugs. You can start your own something small, your first aid in the house. But immediately after that, consult or reach out to any health facility and then start giving your history or tell them your problem. Any health caregiver or any health worker who will hear these signs and symptoms that I have mentioned here will not sit down without thinking about TB. So in that case, they will help you to do the investigation to actually find out whether it is TB. Mind you, all diseases are having similar signs and symptoms. So you can't just look at the person's face and say because of signs and symptoms, it could be malaria, it could be viral hepatitis, it could be COVID, it could be any of those things. But because our focus is on early identification of the TB disease, when you come early as it is, we will be able to see it at the early stage. Knowing it at the early stage means that it will not cause you to develop any complications before treatment comes in. And you will not suffer that much, you will not waste resources that much before you get better. So these are the signs and symptoms that will come when the disease is affecting the lungs. But if it is outside the lungs, the major symptoms you also feel is that there's a possible pain at the side of the infection or where the organisms are invaded. Apart from the pain, this loss of weight, night sweat, and other things will also come along. They will flash through with time. So all these things are very good for you to observe and monitor closely. So the 2 types of TB, the latent one doesn't show any signs and symptoms, even though the organisms are. But the active type, surely you can do away with the signs and symptoms, they will surely show. Okay. And I may add something. In all these types of the TB, if you really want to investigate, it comes with different approaches. Okay.
That is a diagnosis, right?
Yes. It comes with different approaches. The active type, if it is affecting the lung, it means that you can cough up. Okay. You can cough up and give us the sample we think that if really it is TB bacilli, they will be contained in that sample, and that is the sputum. The one that I cautioned that we shouldn't be throwing it outside anyhow. We'll get that one, and then we can use it for laboratory investigation to ascertain the fact that if it is a true TB disease, we'll find it out. That aside, if the person cannot cough, the next thing is we should think of asking the person to do chest x-ray for us. Then we'll examine the chest x-ray and we'll see the features. If it is really TB, we'll pick it up from there. Then we can also take fluid from the side where the person will keep complaining that there is pain. Sometimes you could see that the lung has even swollen, that water has collected. We call that one pleural effusion. So we pass to and we'll pick some of the sample there and we'll go and investigate with it. And apart from that, those that does not come with signs and symptoms, which is the inactive one or the latent one, test that we call tuberculin skin test or Montos test. It is just like the BCG vaccine we used to give our children at birth. As I stand here, I have a scar here. You will just do that test and it will help you to know if you are harboring the disease-causing organism, which is the TB bacilli, without knowing. That test will help you. And that test is also good for those who report to the hospital and they are very sick, they are not conscious or they are consciously impaired, because you can't ask them to produce the sputum samples. So what you ask them to do is that you will do that test for that group of people who cannot speak, who cannot listen to instructions, including children and those with hearing problems and other things. Those tests are there for such group of people. So this is how we do our TB investigations there to be able to help people who come to our health facility for TB diagnosis.
It means you may have some problems diagnosing and treating TB in low resource settings. What are some of those what do you call it, challenges that you encounter?
Okay, so there are challenges. They ranges from few to many. Let me put it that way. You know, all these tests I'm talking about now, most of them has to go with sophisticated machines to be able to perform the investigation or the diagnosis, except the sputum smear preparations that lower levels of healthcare they can perform. Okay, most gene expert machines and other chest x-ray machines are not with such group of people, and it becomes a very big problem for TB diagnosis at that level to occur and occur smoothly. So sometimes they have to employ a strategy we call courier system. Courier system means that there should be a system where whether we have drone or we have any mechanism that we can pick sample from one point to another point for the investigation to be done, and report are being sent back to the health facility so that they will know the status of the client and take a decision as far as the case management is concerned. So that is one of the major challenges, because when it happened that way, it may delay decision taking on the part of managing the patient. For example, when COVID was on, Yes, I was here that time. So what we were doing is that we also didn't have most of the machine for the TB diagnosis here. So for the COVID diagnosis here. So what it means is that I always have to send samples to Accra, that is Noguchi, Legon campus, for investigations to be done. I won't get the investigation that same day. I have to come back for some other day to go again and get the results before I bring it for the doctor or the clinician who is seeing the case to see the result and take a decision, look at the process and the challenges involved. But now that we have our own here, any small thing we are able to run our tests and take a decision, and it helps in saving lives and also improve management. So TB management and then the investigations or diagnosis are the countries, and these are some of the few things we face.
So you want to come in,
Yeah,
right?
yeah.
You will come in, but I don't know. I want to find out whether in Ghana we are part of those less resource or low resource settings.
Even our central region here, our Cape Coast here, we are even enjoying such challenges. The West, okay, because someone is in Dehia. You heard of Dehia before? It's one of the villages around the Futu, after Futu there. I went there quite recently to do my research. But you see, there they have to pick the sample, then they will transport it to a Futu facility. Sometimes, if they also don't have what they could do, it has to be transported to Cape Coast. You understand? Meanwhile, if it is not resource challenge issues at each level of healthcare delivery, they should be able to have investigations of TB diseases. Then it doesn't matter what type. Okay. As it stands now, the Montos test I'm talking about, it is at the regional level that we have few samples of the things there. And well, sometimes because it's for some special group of people, we think that yes, if they are even not there at the large quantity, once we need to do work with it and we are able to get, we still say okay, maybe it's okay. But ideally, it should be everywhere for anybody who comes, because it is not only in the teaching hospitals or the big facilities that children go, or people who are very sick go, people who cannot hear go, they visit anywhere. So that is some. So we are enjoying it here. That's the answer.
If a teaching hospital, whole teaching hospital is suffering, how much more the small ones?
So yeah, but when you put it comparatively or it is relative, once you go
so
then
even if you have a car, there will be a lot of pressure on it.
Yeah,
because a lot of all those small facilities will depend on you.
Yeah,
Evans, you wanted to add something.
Yeah. With the challenges, you see, it's not only the resource driven that like pose challenge when it comes to TB diagnosis and treatment. Sometimes like individual attitude and behavior. Some people will come there, you diagnose them that they are having TB, then they start running away. Those are some of the serious issues we have around. Sometimes they will give you fake address. You go to the house where you're supposed to administer. You see, we normally do monitoring and tracing so that we can be able to monitor how the treatment procedure is going. They'll give you a fake address. They can even decide to take you to a house that is not their house.
Nobody lives there.
Nobody lives there. They don't know him. All because they want to run away from the treatment, or they want to run away. They see it as like, let me say, some kind of, let me say, mystical condition be like that.
But you quarantine them?
Under normal circumstance, the ideal thing supposed to be that people with infectious conditions supposed to be quarantined, to the extent that if you go to the outside countries, they even have it like a community until you are healed, totally declare that you are healed. They will not allow you to. But Ghana here, yeah, like you are mentioning, you are talking about the resource as in like let me say limited countries. We are part of limited resource country, so we expect that we will follow you to whatever it is, and then we will keep monitoring you. The nurses will keep coming to even administer your drug and all those kind of things. But people keep running away. They keep dodging the system. So those are some of the challenges that like impede the
but it's dangerous. If you have the disease and you run away, then you are going to spread it.
Yes.
So I said it that the one that has been diagnosed, we really don't have to give the medication. There's one thing that we call DOT. It means that direct observed therapy. That has been the protocol and the only formidable way we could have used to make sure that our people that test positive and they are being enrolled on the TB case management, they should go through to be cured or complete successfully. But when you look at the approach, not everybody that can afford it. So the treatment protocols are such that you should come with your treatment supporter. We will not screw you to somebody that you should bring. Bring someone that you think that you can confide in the person. Someone that you think that at a point he can give you support physically, emotionally, and then financially. It's not someone that along the line he can ask you to take the medication and you will shout at the person and threat the person. Somebody that you revere, you respect, and you think that yes, this person can help me go through the course of it. And you bring that person. We will speak with you. That counseling will give you is part of the case management. So it is not you, the patient alone, who will enjoy the counseling. Else, when you take the TB medication, it doesn't matter which type. Sometimes the course is 2 years, others are 9 months, 1 year, and then 6 months. But the moment you start the treatment, you will feel better. The things that we mention of as the signs and symptoms, because the organisms are dying, all those signs and symptoms will disappear. But it doesn't necessarily mean that all the disease causing organisms in your body, they are died or they've been exhausted. Some of them can go on deactivation, like they can go on hibernation. Meanwhile, they are there. The only thing they are waiting for is you to stop the drug and they'll come back. So during this stage, if you don't have someone who will encourage you psychologically, emotionally, and support you financially, or will get food for you, make sure that you feel okay once you are taking the medication. If you were into a particular lifestyle, what it means is that you see you are getting better and you are better already. So you go back to that lifestyle. And what it means is that you are giving opportunity for the disease-causing organism to mutate, change themselves, and come back very well. And that is the MDR type of the TB that you will go for like 2 years treatment regimen. So the challenge is there bunch, but if we get people to understand that if you are staying with a TB positive case, do well and help the person to get better, that would have been one of the major interventions. The person that is positive think that the case he's suffering now is not for him alone, because tomorrow he'll be fine, and now you are the one who will become the victim. So what we often do is that when we get a single TB case, we trace that case to the community. We call that one contact tracing, and we also look for the number of people he stays in the same household or the same room. Then we also try and pick their sample and investigate through other possible means of investigation, so that we can know and treat them as early as it is. Another side of it is that you can be treated and be fine, but it's now that someone has, you give it back to you. And TB, you can get it as many as you can, so long as you are still living. The only thing is that if you are able to take good care of yourself and the predisposing factor is not enough for you, but if the predisposing factors are enough for you, you can get it as many times as you can, so long as you continue to live. So it's risky that we are able to try and take the TB out of our community or the environment we find ourselves. That's when we can have our peace. You understand?
Yeah. Our health is our life. Without health, there's no life for you. We are still discussing TB, tuberculosis, and we've heard a lot on TB. Let me go to the treatment aspect. How is it treated? Let me start off with you.
Okay. So I think my brother has almost deal with the major aspect of the treatment. He said the treatment is not, let me say, like it's not only one same for everybody. You see, if let's say you are diagnosed, the diagnosis go further to, let me say, like find out what actual, let me say, strain of TB are you infected with, what is the quantity, and all those kind. He keep mentioning some terms like MDR TB, meaning that is like the resistant TB. Somebody who, let me say, maybe has defaulted the drug, didn't finish the medication, or didn't take the medication according to plan, or that person got his or her infection from a primary source, somebody who is already suffering from the resistant TB. Such people, their treatment regimen is different. But the normal one that almost everybody knew is that normally for the normal TB, it's 6 months. You'll be on drug every day for 6 months. And after this 6 months, we expect that you'll be cured of it. But the MDR, which is the that kind of resistant one, it goes all the way to 2 years. Like you can be on drug every single day till the second or the last 2 year. So those are when it comes to the treatment aspect.
So the resistance happens when you fail to finish the drug, or you fail to follow the
The due
protocols.
protocol.
Ah.
Or you've, let's say your infection came from, let's say for instance, somebody who already, then you have the infection directly from that person. Automatically, you are also having resistant TB.
But how can individuals support and advocate for the better awareness? Because this awareness, I don't really hear them. This TB awareness. How can individual awareness and resource for TB control and prevention?
Okay, so
The advocacy is very low, isn't it?
if you say how can somebody support, I think what Cafdil TV is even doing now is one of the supports. They've opened your doors for us to come and talk about some of these things. So that is a good support, because this one is going to reach multitude, it's going to reach a lot of people. When you come to the health facilities too, we have the disease control officer, the health promotion officers out at the OPD educating people. Okay, people also goes as to the churches to educate people on some of these things. But we are also, let me say, one way or the other, like appealing to the public once more again, that if, let's say for instance, you have, as a company, maybe a bank, once a while you can write to the hospital, you can invite us, you can even invite the health directorate people, or come and talk to our staff. Most of the banks in town, they used to do that. They, oh, come and do talk, and they come even screen our staffs. We come and we do it
For
because
free.
it's for free. It's our social responsibility. It's the social responsibility of the hospital to give back to the community. So you don't need to just write to the CEO. I want your people to come and talk to us on this condition. It can be that, it can be this, any condition at all. They will look for the specialists in that field. The team will come and they will come and talk to you. A church, you can invite us, whether church, mosque, everywhere, you can invite us and we'll come and then do that. It's another way of you supporting for the awareness creation. If, let's say for instance, you also want to champion a whole program on it, you liaise with the health directorate people and then they mobilize for you, and perfectly it will be done.
Oh, okay. But Abu, let's come to those individuals who have been diagnosed with TB. What support and resources do you have for them?
Okay, thank you. You see, I would say because it is being run by a program known as NTP, most of the individuals that are having TB, their movement plan, their supports, yes, is being regulated by the NTP, which is the National TB Control Program. Uh, Apart from that, the support we give them, I've just highlighted on one, that we give them emotional support, and then we also give them psychological support. I earlier mentioned that even the food we eat, when you eat the same food for 3 4 days, you see that you would want to change and then get another taste. But this one, in fact, there's no any reason that is enough for you to say you are interrupting the pattern of the TB uh, management, and that's why those two things are most important, together with your treatment support that you provide. But when you come to the financial aspect, individually, sometimes what I have observed since I've got into this field is that when they become very difficult, most of their monies for them from the program has not arrived yet. But you look into the issue critically and you see that both the case and then the treatment supporter, they are not living well at all. So sometimes we give the little we have because we knew how much it is important for them to eat and then take the medication. Yes, that is some little challenges that are also in there. But when you look at it, a time will come. They have the money there to support them, but because it's being regulated by a program, there will be some kind of, something I can't mention here. So sometimes the money delays before it comes. So when it comes, we give it out to them. So there is a package for them. There is also some food that used to come, even though today,
Supplements.
yes, it still come. The food is powdered. You use it for some breakfast before you take your medication. Then after some few minutes, you take the breakfast, and then you are good to go. So when you are asking of the support, so far this is what is on paper that I'm aware.
All right. Very soon we'll end the show, but I want us to take a look at how we are going to prevent ourselves from such a serious disease, because from all indications, it shows that one of the most serious diseases, bacteria which can suspend in the air. Unknowingly, if you pass there and it has some, then you would have to. And if unfortunately you don't have a strong immune to suppress it, then it's going to. So what are you going to do to protect ourselves from this kind of disease?
So luckily and fortunately for us, we have vaccine, a viable vaccine for TB. And I think my brother earlier made mention that when they give birth to a baby, from day 1 up to a year, that baby qualified to take that vaccination, which is called BCG. So most of the time we entreat all pregnant women or mothers that once you've given birth, make sure that the nurses give that vaccination to your baby. That is the first one. Secondly, we can also prevent it by ensuring that there is enough ventilation at wherever we are, especially where we sleep. Like, don't just close your windows anyhow. At least once a while, let's air pass through. When you are staying inside a room with somebody or an office, sometimes you can just open instead of using the aircon all the time, open your lower base, let the fan blow the air out. Sometimes you don't just stay in, let me say, dark places forever. Make sure that like you are exposed to the sun rays, because one way or the other, research has shown that anytime they are exposed to that UV rays, it kills them. And and second, other one too is that let's try and then minimize the predisposing factors and then the risk factors. If you've been drinking alcohol, limit it. If you have been smoking, limit it, because some of those things, they serve as a risk factors for us to, let me say, he made mention something that almost everybody, or 98% of people within Africa and Asia, one way or the other, they are harboring the TB bacteria within them, but it's at the, let me say, dormant stage. But if, let's say, for instance, your immune system has come down, all those predisposing factors, which are the diabetes, the hypertension, and those kind of things, the HIV, and those kind of things, suppress your immune system, then now the bacteria grow to become active, when it will now start spreading and all those kind of things. And if, let's say, for instance, you knew that there is somebody who has been affected or infected with TB, we are not saying try and then like be stigmatizing against the person, like be avoiding the person, so and so. No, just put measures in place so that you also not contract the condition. When we go to church, you see that people just one or the other, oh, handkerchief, then they start throwing their handkerchief.
Yeah,
If you know that if your handkerchief is not neat, it's not hygienic, don't
Don't
join
throw
the cloud, because you alone might infect, let me say, thousands of people, hundreds of people that are in that church. We all go there to worship God. We don't, nobody go there with the intention that it's going
Going to
to
contract
contract
disease.
a disease. And mind you, it might not be only TB that you might, let me say, spread through your handkerchief. Okay, if you are in car, you are in the closed room like we are right now here, and you want to sneeze, some of those things are involuntary. If it's coming, you know that you cannot pull your handkerchief to cover your mouth or your nostril. You can use your elbow, cover it like that, and sneeze into your this thing, your elbow. At the end of the day, your shirt end up capturing most of the bacteria, this thing, particles. No. Then you also be able to save other people from getting it. And then try and then don't stay in overcrowded areas too much, like the slums and those kind of places. If you are in those slums and then let me say somebody is having it, the possibility that you be exposed to it is also high. So those are some of the preventive
All right.
measures.
Yeah, Abu, we are going, but he made mention of stigmatization. So, what message are you going to communicate to the public for us to understand, in order not to stigmatize those who have been diagnosed with tuberculosis?
Okay, thank you. Before I hit the, let me add some two few things into the preventive aspect. I said it, but I want to highlight it again. You know, the disease will be able to contain it and probably later eradicate it if we are able to get the people who are exposed. You know, TB, like any other disease, ideally, those who have been exposed to the positive case or the active case ideally should have been quarantined. You know, I have not spoke about the incubation period of TB since we started the talk. It takes a longer period. And if you are talking about quarantine, then it means that you should know the incubation period of the disease. So it means that if you are about 15 in a household or in a room, all these 15 people should be kept somewhere. And while they are taken out, then we are managing the positive case so that by the time the incubation period elapses, we'll be able to know who and who is who inside certain terms of the disease so that for them to, they won't get the chance to be spreading the thing, then we'll take care of them. When the system is so vibrant, our health system, if it is so strong and we are doing this, then it means that the cases will not even increase to that number that we have come to mention here. So contact tracing is the one of the preventive, measure.
Okay.
Contact tracing. We'll trace and we'll get them at the early stage. Then we'll give them treatment. One thing is that they will not spread to others too. Okay. Then I think when you also, when in attempt to look for money and save and be rich, you should also think about your health, that you should eat well and then build an immunity. Your food, when we say eat well, some people are thinking about 5 balls of bangu and hot pepper and then what do we call fish being plenty, but it does not go to that level alone to make it adequate diet. You should get your fruit and you make sure that you enjoy them. Sometimes it's a bit expensive to get some of those things, but you ask yourself that when you fall down with the disease right now and you are coming to my end there and they say, okay, we are booking you for consultation, that one alone is 60 Ghana. But if you take 60 Ghana, you can get plenty fruit and you keep them there. I mean, it is a drug in a different form. You get it? It's a medication. Let me put it that way. When I say drug, there I'm going extreme. It's a medication on its own. So if you don't have this knowledge or you don't have this culture or behavior, you can be hit on by any of those things. So yes, let's come back to the stigmatization. In fact, it is one of the major reasons why the disease keep spreading. I'm saying so because if I'm with you, you are my close friend, and you mentioned it when the program started. Okay. So if you begin to hear that, or your best friend or your friend is having this condition, and you think that the only way you can avoid me, or you can take yourself out, is to stigmatize. Uh-huh. So we back with your mommy. Oh, show one for one, fine. Send me me, I will die and go. But I will not be able to take good care of myself. I will give chance for the organisms to develop to that type of the TB, which is the resistant type. The SDR is there, the MDR is there. The high class ones are coming, and you will get that type and suffer the most. You understand? So all that we are trying to tell listeners and our viewers are that the people who get sick and they are in their domain, they should try in the first place. I'm not talking about only TB, but because we are talking about TB, I'm using it as an example. Any form of disease, being it your husband, being it your whatsoever, your child, any relative or anybody that is close to you, even if you don't have financial support to give the person, don't stigmatize. Else the person will try to hide some of the things. But for the disease, you can't hide anything. You can hide it today, but tomorrow you can't hide again. You grow lean. By this time, no, I didn't say that time. No, there are some couple baby. Yes, so the stigmatization is a very big weapon that is fighting the control of TB, and we don't want it to continue. So we are begging. In fact, this one, I'm begging all those who are listening to us that if they know anybody with TB in their area, even if you are a church, if you are an association, give attention to that person. Help the person to get treated so that you yourself doesn't become a potential high risk population. Because if this room, because it is free of the, let's say, mosquito right now, under no circumstance should anybody get malaria. But if there are mosquitoes available, then it means that the chances of you getting malaria is high because we have the risk factor with us. So any person with TB disease becomes a potential, threat to all of you around. Yes, of course, a fees is a stigma or the basic. He doesn't want to come to the hospital because he thinks that, hey, the might do a maybe and some of those things, it's not helping. So those listening to us, if we can advocate well on TB, stigmatization should be what we should be fighting.
All right. Stigmatization. We should not stigmatize those who have been diagnosed with tuberculosis.
Yeah.
Else, you also be infected with it. Yeah. So you heard Abu Kobna, and also you heard Evans Agamulo from Cape Coast Teaching Hospital. My name has been the same, Kojo Arthur. Same time next week. Shalom.
Mojo